I am Ernest Barthelemy, or Dr. Ernest Barthelemy. I'm a resident in neurosurgery at Mount Sinai Hospital. I'm in my 4th year of training there, so PGY4, about just over halfway through my 4th year of training. I'm in the research phase of my residency, and during the research phase of my residency, I am a Paul Farmer Global Surgery Research Fellow at Harvard Medical School. So most of my time currently is spent either in Boston with the research group that I work with, or in one of the countries where we work, and my current focus is in Haiti, where both of my parents happen to be from. Global neurosurgery is, we can call it a surgical subspecialty of not just clinical practice, but also policy, advocacy, research, and education that looks at how to fill the gap in access to neurosurgical care, primarily for marginalized populations. I was the Department of Neurosurgery's first medical student scholar. I was fortunate enough to be funded by the department to spend a year of my medical school time doing research in Haiti, defining the neurosurgical and neurological disease burden. And I did that very deliberately. What I had in mind was defining how I was going to spend the rest of my career. I think people in this conversation often wonder, well, what do people need? What kind of neurological and neurosurgical care? And in that study, we found that there was a huge burden of both cerebrovascular disease and neurotrauma. So if we look at the neurological need, it's cerebrovascular. What's interesting about that is a lot of the cerebrovascular disease was diagnosed by an exam. Because access to imaging is limited, there was only CT imaging available at one of our sites. So most of these patients who we categorized as neurological presented with some sort of neurological deficit that happened over a time course and had other symptoms, malignant hypertension or something like this, that suggested that this was vascular in nature. But we had no idea what it was. You know, was this a ruptured aneurysm? Was it an intraparenchymal hemorrhage? Was it an ischemic stroke? You have no clue. And that certainly limits what you can do about it, other than diagnosing, controlling blood pressure, and providing supportive care. In terms of trauma, given the limitations on imaging, trauma showed up as the priority in terms of what are the neurosurgical disorders, what do we need a neurosurgeon for? And I suspect that as we develop neurosurgical capacity, we'll start dealing with that and then developing the diagnostic capability to discover other neurosurgical disorders that are hiding in the absence of the imaging that we need.